Good afternoon. Assistant State's Attorney Sandy Stavropouluos from the Cook County State's Attorney's Office, representing State's Attorney Anita Alvarez. I supervise a unit entitled the Seniors and Persons with Disabilities Unit. My people handle close to 4,000 mental health treatment and commitment cases each year. These are mysteriously mentally ill, homicidal, suicidal, catatonic, totally unable to care for themselves, eating disorders, close to death. Bottom line, these are people that need to be stabilized in an inpatient setting before you can even think about outpatient community services. As you heard earlier and as stated in the RFI, 98% of those that go into Tinley start out in EDs, emergency room admissions. This RFI puts the responsibility solidly back on the shoulders of these EDs, these private hospitals. You know, I want to point out again, and Representative Riley talked about it as well, this RFI was published on 4/4, a deadline of 4/20. Number one, this is ridiculous. But let's look at the goals they set out. Noble though they might be, it presumes a widespread support from private hospitals. Is this realistic? Has anyone signed on yet? Will anyone sign on, given the fiscal problems within the state of Illinois? These are for-profit hospitals. You'll see in the RFI, they talk about all these requirements of augmenting their staff. This is money out of the pockets of these private hospitals. Payments have to come from Illinois. Come on, let's think about this realistically. And as pointed out also by one of the representatives, this is cost shifting, not cost saving. Bottom line, these people are hurting. These families are hurting. They need help. They need real help. They don't need cost shifting. They don't need passing the buck. They need a place to go, a place close to their homes, a place that doesn't have the hospital's bottom line as their first priority. At this moment, if Tinley closes, there is no such place. They talk about a plan B. What is plan B? Madden and Reed. Those hospitals are already overcrowded. And one last point, in the plan from DHS, it talks about converting Reed to a long-term care facility only, which means these patients will be left with only one alternative, Madden, which will have no room for them, which means they'll be out on the streets, which means they'll be in the courtrooms all over this county with criminal cases or out on the streets with no place to go. Thank you very much.